Some of us grew up thinking that big companies only spoke in spreadsheets and serious faces. But every now and then, one proves it has a heart too.
At DKSH, it has been part of ASEAN's story for a century.
Growing businesses, growing communities. And this is their story.
In Southeast Asia, access to healthcare remains uneven, particularly in underserved communities. For companies operating across complex supply chains, the question is no longer whether to contribute, but how. At DKSH, community initiatives are not treated as standalone efforts, but integrated into core business operations.
What we've tried to do is really try to incorporate as many of our business partners as part of the initiative. That way, we have such a strong collaboration between the social impact and community impact of the event, as well as what we do with our business.
Operating at the intersection of markets, partners, and patients, DKSH, winner of the Community Initiative Award at the ACES Awards, plays a central role in connecting the healthcare ecosystem.
We're really at the center that connects the ecosystem. And because of that, we have this unique opportunity to really be able to support and touch patients at all levels and all communities.
This position allows the company to extend reach beyond commercial endpoints into communities where access remains limited. A key focus is ensuring that impact is measured not only in scale, but in inclusivity.
If I could, I would look at the number of patients that we touched. More than that, I'd look at the number of underserved patients that we touch. A big bulk of our business is in markets, especially in Southeast Asia, where the healthcare ecosystem is still fairly underdeveloped, and there are still a lot of patients that could use more care and get more care that they deserve. And so we pride ourselves in being able to bring healthcare solutions, products, pharmaceuticals, life-changing and life-saving drugs to these underserved communities and patients.
In markets where healthcare systems are still developing, these interventions can be critical. While financial performance remains essential, the organization frames its work through a broader purpose.
Your financial goals are your targets. They're your KPIs, profitability, net revenue. And it's good to have ambitious targets and KPIs. But that is not our mission, that is not our purpose. Our mission and purpose at DKSH Healthcare is to deliver healthcare for all, enriching people's lives.
This alignment between purpose and operations helps shape decision-making across the business. Employees engaging in initiatives, events, volunteering, maintaining that connection at the employee level remains an ongoing effort.
And sometimes we forget that the work that we do, especially at DKSH Healthcare, can really impact patients' lives. And it then goes back to that purpose, healthcare for all, especially those that are underserved. And when we continuously remind ourselves of that, when we hear stories about how we can impact patients, when we have events like this, Patient Purpose Day, that reminds us of the importance of the work that we do, I think it is able to really bridge that gap.
These initiatives aim to reinforce the link between daily work and real-world outcomes. Early-stage events to larger-scale activations across markets. One such initiative, Patient Purpose Day, which began as a small internal effort.
But it started out as a very entrepreneurial initiative, an idea that a group of us had where we really wanted to showcase the importance of patients and the impact we have on patient outcomes in the work that we do. So when we first started it in 2023, it was very much pick yourself up by your bootstraps and see what kind of work we could do. We didn't have very much budget. Not a lot of people knew about it.
It has since expanded across multiple markets, evolving into a recurring platform for engagement, global context, sustainability, diverse communities. As expectations around corporate responsibility continue to evolve, companies are being challenged to address both environmental and social priorities.
I think even better if we also put in as much effort into the social part, the diversity, equity, and inclusion, human rights, and the due diligence that needs, the social impact on our communities.
Increasing global complexity further underscores the need for sustained commitment.
Delivering healthcare for all, especially the underserved, enriching people's lives.
So while the world refreshes for the next big headline, DKSH continues to show up, steady, committed, making things better. Proof that powerful impact doesn't shout, it just shows up. I'm Anne Edwards for ACES.